Hi, my name is Maria Mendocino. I am very excited to be applying for San Jose State's MSN program with an emphasis in the FNP program. I am currently a registered nurse of 2.5 years, primarily all in the emergency room. I started at a level 2 trauma center, and we would treat patients anywhere from a tier 1 to a tier 3 trauma patient. And I really got to learn rapid assessment skills using things like the massive blood transfuser, prioritization, and also adaptability. I often find that the traits of an ER nurse can make you a really good provider because you have to be adaptable, coachable, and always eager to learn. There's always something new coming in, and I'm constantly learning. I often find myself going home, researching diagnoses on my patients if I haven't seen it in a while or something that's rare, and looking up mechanism of actions of medications that I'm giving. I always want to be knowledgeable, and I want to provide that knowledge to my patients, especially when they have questions. And I really have a passion for education. And I think a big part of being a provider is providing that education to patients and giving them those primary and secondary prevention measures they need for their illnesses or preventing illnesses. And as a FNP, I think I'm ready to step into that role. I'm adaptable, I'm eager to learn, and I'm open to changes within medicine and using evidence-based practices to incorporate in my future practice. I want to be able to step into that provider role and diagnose and prescribe and truly just learn more. I've heard great things about this program. My friend who is in the MSN education emphasis program, she is loving it, learning a lot, and has great professors, and that's the type of environment I want to be surrounded by. People who are passionate, people who I can learn from, and also grow professionally. I'm ready for that next step. I also am on the education committee currently at my current position in the ER at a STEMI and stroke receiving center, and I'm often always finding gaps within our ER and trying to find solutions to fix it by also teaching nurses about certain topics or giving ideas to my nurse educator on what other things we can educate the nurses as a whole about. And I think being a FNP includes a lot of education, and that is something that would give me a lot of fulfillment. So thank you for listening.